Dr. Jaffe, why is homocysteine considered such an important predictive biomarker, especially with regard to cardiovascular risk? And can you explain exactly how the nutrients in PERQUE vessel health card can help manage that level?
Well, if you go back to the 1960s, Kilmer McCulley, a pathologist at the VA health system, noticed that people who had high homocysteine had accelerated hardening of the arteries, atherosclerosis, risk of myocardial infarction and heart attack, risk of stroke. And he pursued that vigorously for decades, to the point where today a properly measured plasma homocysteine is an all-cause morbidity mortality marker as well as a risk marker for cardiovascular disease. So it's really important, but it's also difficult to measure properly. And by proper measurement, we mean a plasma specimen that is very quickly spun to separate the plasma from the cells. Because if your cells leak homocysteine, which they often do when they are just in contact with the tube and the plasma inside the tube. In fact, there are many laboratories that will not process a homocysteine if it's been more than 20 minutes from the time the specimen was drawn and the time it was spun. So yes, it's a very important marker, cardiovascular and all-cause morbidity and mortality, but it should be measured accurately. And in regard to what is it that makes a healthier homocysteine, it's sufficient B complex. So we recommend our lifeguard family to keep your urine sunshine yellow, taken with food, and under the tongue, dissolve vessel health guard that allows essential nutrients to be taken up before you swallow them, go to the brain before the body, and not only lower homocysteine, but raise methionine. It turns out that in biology, it's almost always a ratio. In this case, it's the ratio of homocysteine, which you want low, and methionine, which you want high, but not too high. Because methionine is the intermediary for methylation, which controls how your DNA is transcribed, how it is translated at the ribosomal level with the RNA, how it is quality controlled in terms of the products of this process, a most remarkable process. So we want to measure accurately. We know that the best outcome value for properly measured plasma homocysteine is less than 6. We know from clinical experience that those who use PERQUE Vessel Health Guard along with other PERQUE supplements lower their homocysteine. Not always to less than 6, but in the cases where people very promptly have the specimen processed and analyzed correctly, the best outcome value is less than 6. And lower is better because it raises your methionine, and that makes everything work better. So this is a rather important observation that we have added to. We didn't make the original observation. What we knew was you needed to give nature's forms of these B complex elements and sufficient, when possible, to go to brain before body. And that's what the advantage is of full disclosure, bioavailable, clinically well tested and well validated PERQUE Vessel Health Guard to get a healthier homocysteine level.